Welcome back to another episode of Med Talk. Today, we will be discussing and going into depth about an evidence-based breast cancer intervention. My name is Maggie, the producer of this show, and today we are back with our co-hosts Abby and Angela, accompanied by our fact-checker, Ren. We also have a special guest speaker, Dr. Cheryl Knott, joining us today to give us some insight on breast cancer disparities in Maryland as we go through our discussion of the case study.
All right, and just a brief description of the case. This case study was conducted through an intervention study with a face-to-face control group. Then the intervention groups had Korean American women take a 6-month education program for breast cancer awareness. And after 6 months, they interviewed both groups, 92 in the control group and 94 in the intervention group, and saw how they planned on getting mammograms, how often. And they used the generalized estimating question analysis, and in conclusion found that the intervention planned on getting mammograms 2.92 times as much as the control group.
Thank you, Angela. So the interventions that were discussed in the case study, some of the most important aspects of it is increasing awareness and knowledge about cancer, specifically breast cancer. We should dictate a lot of our time and resources to increasing health literacy for all women in Maryland, but we will focus mainly on Korean American women living in Maryland. So doing this can lead to early detection and improved outcomes after diagnosis. In Maryland specifically, we will work to increase breast cancer uptake by making mammograms more available and affordable for all. And by increasing uptake, we can increase the number of Korean American women that undergo screening, and this will inevitably lead to early detection and conversely improved outcomes.
Okay, thank you, Ren. So now that we've discussed the case study, let's start the discussion.
And once again, we'll introduce our guest speaker, Dr. Cheryl Knott. How are you doing today?
I'm very well, thank you.
Could you please give us a quick introduction of yourself?
Sure. I'm a social psychologist and I'm a professor at the University of Maryland School of Public Health. And I also serve with the University of Maryland Greenfound Comprehensive Cancer Center as their Associate Director for Community Outreach and Engagement. And I'm involved with the Population Science program there as well. So I have a couple of areas of research. One is interventional research, where we go into the community. We try to increase screening rates through communication strategies. And another area of research that involves multi-level drivers of cancer risk prevention and screening behaviors. Thank you.
Wonderful, wonderful. So we'll just dive right into the questions. First, we'd like to ask you, how can educational programs be established across various communities or populations?
Sure, that's a great question.
Yeah, getting to the mammograms and breast cancer awareness.
Sure, that's a great question. I think it's important first and foremost to engage the communities and constituencies with whom we want to serve and who we want to reach. It's important that we don't come in from outside with a message asking folks to do something without them having been involved in developing that message and developing the approach. There's nobody like with the right expertise about how to reach the community than community members themselves. So certainly I would encourage using community engaged strategy, and to the extent that we can, also evidence-based strategies, those that we know have been successful in the past.
Right. It does make sense to have the people who are most affected be involved in the process. Abby?
Yes. So are there any ethnicities that you think are more predisposed to cancer?
In terms of genetic predisposition or other predispositions, it's a little out of my area of research in behavioral science, but I will say certainly we know that there are groups that have disparate outcomes. We know that there are groups that have disparate access to screening. And there is some research in that area about genetics and so forth. I'm not probably qualified to speak to it in detail, but I'll say that it's possible. We know that cancer is multi-determined. It's incredibly complex. It's hard to tell for any one person what caused a particular cancer, but we are seeing genetic variations. I've read about studies that looked at the characteristics of tumors, for example, or aggressive cancer, or the age at which cancer might hit a particular group. So there is research out there in this area we should continue to develop.
And just to follow up with that, do you think that there are any ways in particular, if possible, to combat these disparities that we see, and whether it's in the outcomes or?
Certainly, there's many approaches that have been developed over the years to encourage people to support healthy lifestyle, to prevent cancer, for example, or to get screened, early detection. And so we have an arsenal of things that are considered evidence-based approaches. And so we can develop more of those approaches, or we can put investments into implementing, adapting, and scaling up the approaches that we already have that we know are effective from clinical trials, and putting those into communities and making sure that they fit the setting and the audience. There's also structural factors to consider. So there's, health and cancer is very multi-determined. And so everything from where a person lives to their exposures to their access to healthcare, access to healthy foods. So it's something that we all need to work together on a very large scale, with partnerships. When you're talking about impacting something like policy or impacting neighborhoods, making structural changes. So these are large efforts that are going to really need considerable partnering, and able to do them. We almost can't do any one of them all on our own.
Right, we'll take everyone's help. Another question, how can we improve health literacy rates for those who do not speak English?
Sure, we can. I think we need to really meet people where they're at in terms of the folks, what they bring in terms of their own literacy experiences, or we have to make our information accessible. And certainly there's a whole field of health literacy that has studied and is studying how to do that. There are best practices, there's plain language, there's graphical representations. So we need to really bring all those approaches to make our information as accessible as possible. It's very important.
I want to finally just ask you, like, what inspired you to go into cancer research and to understand the different disparities between like health issues?
Sure, that's a great question. So I think I may have mentioned that my training is out of psychology, but as a doctoral student, I was studying in a public health research lab. And in public health, I became exposed to um, themes and values around social justice, and research in the area of cancer disparities as well through working with my mentor. So, these are things that I wasn't necessarily getting exposed to in psychology training, but my psychology training came in with respect to developing communication messages that would encourage health promoting behaviors. So it really was during my doctoral program where I got exposure to the field of public health, and to the way that we operate in public health, with a high value on diversity, a high value on social justice.
Question real quick, not really relating to the last question, but how can we as people within the public health field, I'm not sure if you actually already touched on this, sorry, help kind of like suppress the disparities, like when it comes to like like not health cancer, and with cancer in general, like with the SDOH, like the sustainable health goals and stuff like that.
So I think your question is around how can we minimize health and cancer disparities? Is that right?
Yeah, sorry.
That's okay. We did kind of go into that a little bit. Let me see if I can think about it a little differently. Um, Training the next generation is really important as well, and that our pipelines in the STEM and in public health and in related fields need to look like the population that we're serving. So that's another, way that I think we will make progress when we have more inclusive spaces for folks to develop in these areas. That's I think that's going to be a really important part of it moving forward.
Awesome. Thank you so much.
And just to also chime in with this, do you think that there's any glaring areas? Because I know every field has their own things that they need to work on or ways to improve. But do you think that there's any glaring areas of um, improvement that can be made within um, the whole public health as a whole, or just specifically within cancer treatment and awareness?
Sure, there's a couple of ideas there. Um, One involves data and big data and data availability. We're hearing a lot about leveraging data to to improve practice or outcomes or whatever. I mean, another big one for me is implementation science. I alluded earlier that we have a lot of evidence-based interventions, if you will, out there that have been funded by taxpayer and other dollars, donor dollars as well. And so I think we should be pushing to continue to grow that field of implementation science that will teach us how to have these interventions be more impactful by reaching more people. Another area that is continuing to develop is precision oncology or precision medicine, and with greater sophistication and personalization of cancer treatment, we are seeing more personalized and precision medicine. So that's an area I think we need to continue to invest in.
A follow-up question from what Ren had asked earlier. How do you think we can like motivate more students and people like majoring in public health or not those like not even in college yet to like care more to like support different researches and investigations and kind of like pay more attention to what's going on around them in their communities, in their world, and how people like the health issues are impacting them?
Sure, it's a great question. I'll take the first part first. The public health is often a discovery major, meaning that students in undergraduate, for example, they don't often necessarily go into undergraduate thinking, I'm going to major in public health. They may be majoring in pre-med or biology or another health-related field and want to pursue a career in the health sciences. And many find public health along the way as a great way to embrace community and behavioral change and so forth and to be in touch and impactful in the community. And so if we can continue to champion ourselves in public health and get the word out about the opportunities that are there and opportunities at many levels, not just degree seeking opportunities, but opportunities to build capacity in a regular just neighborhood residents, whether or not they're enrolled in a public health program. So we need to be thinking about building capacity to support healthy lifestyles, capacity in individuals, in organizations, and in neighborhoods.
Does anyone have any more questions? Nope. Okay.
That was good. That was wonderful. Thank you.
What a pleasure to meet you all today.
I'm so sorry.
No, that was it.
To summarize, can we get like a statement about your opinion and like a quick message from you
My opinion on
on
Just the overall topic of breast cancer and just any sort of message that you would like to push out to the people.
Sure. I think for folks coming up, for folks who've been in public health and health promotion for many years, and for folks who are just coming up in this area like you all, I think we have to remember that our impact is occurring I think about it as occurring as one person at a time. And so we want to make our communities stronger and healthier. And sometimes it feels like, are we moving the needle? Are we actually making an impact? And we're working very hard, but are we seeing impact, if you will? Are we seeing a difference that that we'd like to make? And I think if we just remember that we're really impacting people one person at a time, and that's very powerful. Sometimes that helps me when I think about are we making a difference, and we have to have faith that we know that we are, but it really does occur one person at a time, and it's that one person that finds cancer early as a result of some information that they got, and that's life changing, not only for them but their family and their community.
So it's definitely clear to see that there are like many disparities between women with breast cancer and other health issues. If people were to be more aware of like cancer warning signs and symptoms and seek out like assistance as possible, like thousands of lives could be saved simply because early stage cancer treatments are a lot more successful than when it's like later in the stage. So I feel like we can definitely dedicate time and resources to increasing health literacy for women, and especially like for the case studies topic, Korean women with breast cancer in Maryland. So I really thank you so much for coming and for sharing your opinions and your thoughts with us. It was really informative, and I really really thankful.
Thank you. Well, I'm thankful for the opportunity to share with you today, and thank you for all that you're doing and all that you're going to do. It's very exciting work. There's a lot of work to be done, but it's wonderful to chat with you today.
Yes, thank you for coming. We really appreciate it. And thank you to our listeners in this episode of Med Talk.
Thank you so much.
Thank
Thank
you.
Thank
you.
you.